people who have had strokes, they can't talk, but they can sing. Some people with Alzheimer's too, they don't know their address, but they remember the words of songs verbatim. There's something in the brain about music that stays in the brain. People can deteriorate if they're not stimulated. I guess what I really try to do is just to bring something incredibly positive. There's a song for everything. And then, so that sparks these people's memories, and then I get them going. Don't be afraid to sing. If you don't think you can sing, I bet you can.
It's so good to see you again. You're a music therapist, which is something I don't think a lot of people really know much about and exactly what that means. Like, are you a sound healer? Are you a therapist? Why don't you start with just kind of talking about what is a music therapist and paint a picture for everybody?
Okay. Well, I did study music therapy at university, quite a few years ago. You have to have a level on one instrument for sure, and then studied the whole field of music therapy and done exams on it and, done an internship and been supervised, and gotten accredited. So all of those things are, important for being a music therapist.
Is it kind of like half music and half therapy, like the schooling for that?
It's very interesting. I mean, I did it a long time ago, and I still try to take courses as much as I can because I find it so stimulating. And so, yes, there's psychology, there's group dynamics, there's music therapy techniques. I remember I was a classical flautist, right? That I started playing the flute when I was 8. I was very grateful. I had good teachers and did the Toronto Conservatory exams. And I had somebody talk to me the other day saying how much they hated that. She said when she was a kid, she hated having to practice all the time and everything. But now she's so grateful, right? That she had that piano instruction and she loves to sing now. And so anyways, I mean, some people find that traditional classical training to be stifling, but the level that you can get to in that classical world is really fantastic.
So you started as a flautist. That was your first instrument. What was your kind of journey into becoming a music therapist?
Well, I was considering whether I would, have a professional career as a classical flautist. And then I was thinking of nursing, and this physiotherapist from England told me about music therapy, and I had no idea what it was. But I was just lucky because it was offered in the city where I grew up. There was a training center, and not that many places offered music therapy training at that time. Now there's more places in Canada and lots of places around the world.
What kind of facilities and stuff do you work for?
I'm working in long-term care a lot, but with different levels. I might be working with seniors in the beginning stages of Alzheimer's or people who have had strokes. And then I'm working with people that have way more advanced dementia, doing a bit of palliative care. I've done some work in hospice, done some work in psychiatry, post-stroke. And then I work with high functioning seniors in the community. There's adult day programs where seniors who are isolated can come for the day. And if they have a caregiver, the caregiver can have a break and the person gets a good meal, and a speaker, maybe a motivational speaker comes in. And I do that as well. I work in these adult day programs. So it's really about relieving the isolation of seniors. That's so important.
Mm, totally. Like the maybe kind of like monotonous loneliness and all that. And then you come in. I mean, I did get the honor of shadowing you for a day, which was very fun because I wanted to know more about music therapy too. And it was very cool to see you do your thing. I'd walk into the rooms and the crowds that you're talking about were not very full of life, let's say. They were kind of sitting around, maybe getting their next meal or watching something on TV and kind of just there. And you would come in and give them things to participate in. So they got up and they're maybe shaking something, or you even give them, one of the coolest parts was when you had a whole circle and you gave them different tuning forks with the different notes. So one would be a D, one would be a G, one would be a C. and you got them to play a song by saying, okay, ding, 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 right? And it was really cool to see what you come in and you're just like a breath of fresh air. And for an hour, these people get off their chairs and they're even dancing with you and you're bringing all this energy. It was very special to see, actually.
I remember the lady who used to take belly dancing, and now she looks like she's 110. Like, I don't know how old she is exactly, but she can still belly dance. And then I asked her to lead because the movements with belly dance are so cool, and she knew how to do it better than I did. So, yeah, that was really great, and I know you've got that on video. That's the whole thing that I do in long-term care, especially. Like, I'm not performing a concert. I mean, I do that. I had a wonderful thing happen a little while ago where someone I know, he was the church organist for the Queen in Windsor Castle. And I don't think I'll mention any names right now because he's got a PhD in music, but I played with him years ago in Nelson. He was brought up here in Nelson where I live. And now his dad is in one of the units where I work there. And his dad was a very good violinist. His dad has got a little bit of dementia now, but he was visiting his dad. And I played with him a long time ago. When I saw him, I said, "Hey, I've got all these Bach sonatas and piano accompaniments here. Would you like to sight read them with me?" And it was just a very impromptu thing that we did. But we went and we put on a little concert. So then I would invite people that I know love classical music come to hear us. So I'm trying to involve them because whatever we can do to stimulate them and get them to participate, doing something with their body or promoting discussion or, that's what I'm trying to do, not come in and perform.
And you find in what ways does it really help them?
Well, it depends on their level, right? If some people are really regressed and it might even be like they have contracted hands. I would give them a shaker or something, or just like anything to bring them out of their own isolation. With higher functioning people, I'm promoting discussion, reminiscing, because the music is in their brain. People who have had strokes, they can't talk, but they can sing. So, and there's this thing called melodic intonation therapy, which helps people try and regain their speech through vocalization and through singing. Some people with Alzheimer's too, they don't know their address, but they remember the words of songs verbatim. So there's something in the brain about music that stays in the brain.
That's amazing. Through a stroke, you lose your speech, but you can still remember the lyrics to your favorite music.
Yeah.
Incredible. I see some harps with you there too. So you play the flute, the harp. What are
Yeah.
you really into right now?
What am I really into? Well, I started the flute when I was 8 and I got to a very high level. And I still am at that level to some degree, although having to maintain that level is interesting because I have other things to do too. But I have this beautiful harp and I really want to focus on the harp because I love the instrument so much.
Would you want to play something? What gets your heart going right now? Do you want to play a little harp, a little flute?
Maybe what I'd like to play, this is a piece that I played for my grade 4 exam, Toronto Conservatory, when I was 10 years old. So I've played this piece a long time.
What is
And
it?
I really love it. It's the second movement of a Bach sonata. Bach wrote quite a few sonatas for flute, and I'd like to play it for you. these ideas and these visions, I've worked directly with this one doctor here. I mean, alongside him for maybe 30 years. He's a wonderful man, and he's the doctor at all the seniors facilities here. And he's also got a beautiful voice and plays the guitar quite nicely. So he comes and sings with me sometimes, and I love that. But just getting music more into long-term care, but also acute care. Like there are parts of the world where music therapists are working post-op, like for anxiety amongst the staff or the patient. And so, for example, there's a man that I know right now who used to play the violin when he was younger, and he has a little bit of dementia now, but we have like a world-class violinist in Nelson here. She's a young woman. I mean, we have very good violinists here, wonderful musicians of all instruments and genres. But I think it'd be such a wonderful program to have those musicians coming into the facilities, right? And it's not really fair to ask people to volunteer all the time. I mean, we do need volunteers, and volunteers are so incredibly valuable, but it would be nice if there was some kind of funding available so that, musicians could come in and play, for hospice or in acute care as well. So that would be a big thing that I would like to see happen. I've done it so many times, but the parents always had to pay. Or there was a program at one time, it was called Success by Six, I remember, where there was funding available for programs for lower income families. So just more programs, more things like that, more funding that is going to improve for children and for older aged folk.
Thank you. Yeah, in what other ways are you offering your services right now? Do you do privates?
I do private sessions in the facilities where I work. There was a man who was an internist here where I live, very competent doctor, and he was also a very good singer. He ended up getting dementia, and I was hired to work with him privately. And the fact that he knew so much music before he was diagnosed, he loved music so much, and it was a way to calm him down if he was agitated. He was actually a good dancer at one point, and his daughter hired me. She was a head nurse at one of the places where I work, and she said, "Do you teach dance?" And I went, "No." But as a matter of fact, I took dancing lessons. I have been taking dancing lessons for the last couple of years, mostly because it started with him, because he wanted to dance with me. And I thought, I don't really know if I'm waltzing properly or anything. So I started taking this swing fusion class, and now I'm doing tango. But dance is very good too, for Parkinson's particularly. But I do a lot of movement in my music therapy groups, kind of as a warm-up, because we know that deep breathing is so good for our bodies, particularly for our voice. And then I do movement to music and movement with scarves, and we have these big parachute things that everybody's holding on, and get upper body movement with that. So I combine a lot. And that man that I was talking about, he was wonderful for me to work with. He was very easy because he was so musical. And I eventually sang at his funeral, and it was very, very powerful, for the family to include me in that, and they were very grateful.
Yeah, well, speaking of dancing and that video you were talking about earlier, I came across that video on my laptop, and you were dancing with like maybe a handful of very old people that probably don't dance very often. They must have been 80 or 90 or something. And it was pretty fun to see. I mean, for maybe a 3-minute song, these guys were all moving around belly dancing with you. I mean, they probably don't even move very much, but it was actually really great to see. They were doing pretty good. Quite good, actually, much better than I could have ever imagined.
Well, in another place where I work, I'm connected with the dancers in this community now. We put on a dance party, and so there were 3 couples that came in. They, good dancers, and I was playing live music with another musician, and they all got dressed up. And then they danced for the seniors, and it was so great. And so I guess what I really try to do is just to bring something incredibly positive in there. Like, so with the music, with what I do, or with bringing children in, and, there's a lot of dancing that can be modified for people in wheelchairs. And so those dancers that I know, that's another thing is we would really like to go in on a regular basis. And, if you can catch people younger, right? People I think can deteriorate if they're not stimulated, and it's a really big thing for people not to be isolated, and even with their mental health or whatever. We're trying to prevent deterioration and maintain whatever skills they have through singing and playing instruments, like what you're talking about, those tuning forks. Those are actually called chimes. And even those chimes, like, they're worth, I don't know, one case of those chimes probably about $1,300. And we call it bell choir, and I lead bell choirs in all those places. And you know what? Sometimes people that are like really far into their dementia, they can still do it. So that's what I'm trying to do, is just find anything that they can still do. You know?
Must take a lot of energy for you to go in with so much positivity and just bring people up like that for an hour, then you're on to the next one for an hour, then you're on the next one for an hour, and you're going into these really sedentary, stuck situations and bringing life to it. I'm curious your thoughts on that and how you keep yourself at such a high energy to be able to keep giving so much like that. Like, what are your practices? What's your lifestyle like that keeps you able to do that?
Well, I'm completely organic, have been for a long time, but I have the privilege of eating organic food, right? And I love to do Qigong. I find that Qigong is a real energy builder. And another thing that I do is I use recorded music. I mean, one of my instructors would say to me, even when I was talking to her about visiting my own mom, who's 97, who lives about 8 hours away from me, she said, trust the music. Just trust the music, because I use a lot of my voice, and I'm not just sitting there playing the piano or the harp or something, because I want to see what's going on in the group and try to bring people in, or, if two people are talking, then I go and stand in front of them so they'll be quiet, right? That kind of is what a teacher does with, young children. I have to do that a little bit too in my music therapy groups. But yeah, the recorded music can be amazing for keeping the momentum up. Like, I do like calming music at the beginning for vocal exercises and things like that, like, the breathing, and then I get into vocal exercises, but really upbeat music, especially, there's a song for almost everything in your life. Like right now, we're coming to the end of summer, and, I'd be doing like, Gone Fishing. That's a really old one with Louis Armstrong. I can't remember who else, but like I have such a repertoire of songs in my head. I feel like there's a song for everything. And then so that sparks these people's memories, and then I get them going by clapping or tapping their feet or whatever. So the recorded music is fantastic. It really keeps the momentum up, and it gives me a little break too.
And it allows you, I guess, to do different things than just playing music yourself. You can go and interact with them and bring them up and guide them around and be more hands-on with them during that time. Is that right?
Yes. Mhm.
And would you say that your sessions, your hours kind of follow a bit of a pattern? Like you said, you bring them up slow, get them warmed up, and then they kind of get up and dance a little bit or move or sing or something, and then you kind of calm them down. How does that look like?
Yeah. I even do these simple little hello songs where I sing hello to everybody, and I know all their names, right? So, and that's the difference also with being a music therapist that's there on a regular basis, is that the staff are familiar with me, and I'm familiar with the residents. And, when they have care conference, or they get together with the doctor and the health professionals and the family, I share what's going on in the music therapy group. So sometimes people are really happy, like if it's someone who won't go to anything else, and I can say, oh, well, they do this. They'll play a chime, or they really participate in movement well, and or they have really good eye contact, or they talk a lot about their past. Like, it's a good thing to have a person's social history, like their work history, where were they brought up, because I can use that in my music therapy group to bring them in. If it's someone from Italy, then I'll play like Santa Lucia, like, so whatever type of work they did or what their hobbies were is really valuable for me to reach them now, at their elder years.
I'm curious about your privates too. Who would that be for? Like, let's say somebody wanted to work with you. What kind of person would that be for, and what would they get out of it?
Well, the way that it is in the institutions, that's where I have all the private clients right now. And, I have one lady and she has a lot of anxiety. And she can be quite disruptive, either in her room or out in the main area with others. And so what I'm doing there is really just trying to calm her down, trying to help her with anxiety. Like, she loves people being with her. She hates being alone, and she loves one-to-one. So that's the thing too, is that volunteers in these facilities are just fantastic. And I don't think that there's enough people that know how valuable they could be and what the need is. And with her, I'm working on anxiety. And also, she can still play the piano to some degree, like nothing like what she used to. But she recognizes pieces. And that's the thing, is with my background, I know pieces that she probably played. So that's very valuable. Like, sometimes I'll play something just using my Spotify, or I can play the piece on the piano and I enlarge the music, and then she can just plunk out the right hand a little bit and it makes her feel good. So it's the music, because she has such a background and such a love for it, it really helps calm her down.
Awesome. Ruth, what's exciting and interesting for you in life right now?
Mm. Well, I have a symphony coming up in October, so that's always so exciting for me. I drive 3 hours to a town that people from all around come to, and I feel really honored to be able to play in the symphony. I've been playing it for a long time, like maybe 15 years, and it's so different. Playing in the symphony is completely different than what I do as a music therapist, and it seems easier, but it is very challenging, and you have to be, really well rehearsed, and but it's so exhilarating for me. I love it. I really love playing the symphony. And I think that just in general, what I do as a music therapist is, you know, there's all this stuff going on in the world now, right? Like the Gaza and, global warming and everything. And I think it's just so wonderful if we can find things that are still creating beauty and appreciate, like, nature. Like, I live in a very beautiful place, mountains and lake and, you know, bountiful. Like this year, there's the bumper crop of berries and everything, and because we've had a perfect summer, not too hot, we've had tons of rain, it's still really nice and green. It's just beautiful here. And so I get excited just about natural beauty and tuning into it myself with my job.
The Kootenays in British Columbia, Canada are really breathtakingly beautiful. Wow, it's incredible. The lakes and the mountains and just the endless green, and it's just stunning there, to be honest. I actually spent 4 months in a camper van traveling all around the Kootenays last summer, so I just got to experience all the different mountains and the lakes and spend a few days in this area, a few days in the next area. It was very fun. Just
We shouldn't be talking about it, because then all these people will come here and invade my beautiful town.
yeah, they'll only stay a few weeks, don't worry. Yeah, it's very nice there. It's very nice in so many places in the world, just different flavors, right? So, how about this, Ruth? If you had one message that you'd love to broadcast to humanity that you think they could hear from you and you could help people and help their lives a little bit, what would you tell everybody?
Well, mm, It's a little difficult. What one thing would be, don't be afraid to sing. If you don't think you can sing, I bet you can. That would be one thing. And also, when I teach kids, I used to give playlists to the parents for the kids to go to sleep. I taught babies, right? And prenatal and everything. And I created a playlist of just incredibly beautiful classical music. And I feel like those children might never hear those pieces, or there's some people that would never know these pieces. And I think that that's such a shame to not know those pieces. So I would say Google, I don't know, relaxing classical music or something like that, and just start because it's so powerful. Like the Mozart flute and harp concerto. Oh, it's breathtaking. The Bach double violin concerto. I mean, they're just fantastic. And in this day of digital, I'm hoping that kids will still learn how to sing and how to play an instrument, because we don't want our children or adults to just be pushing the power button. We want people to learn how to do it themselves.
Thank you. Those are two of my favorites, are just like best of Bach on YouTube or best of Mozart on YouTube, and just start an hour or 2 hour playlist, and just so powerful, so beautiful to have on. Some of my favorite stuff.
You can do art to that music too. The music can inspire art and dance, right? They all work together.
How would people get a hold of you if they like what you do and they want to donate to your cause or inquire about sessions? How do people get a hold of you or look into what you're doing?
I would say, my email would be good, and I can contact people. If people email me, I will respond. And yeah.
Thank you so much, Ruth. Amazing. Thank you for your friendship and just everything you're doing. It's awesome. And so I really appreciate you being here. Thank you.
Welcome. Thank you for asking me.